4 Marine helicopters just slammed into the parking lot of a civilian hospital. Armed soldiers are pouring through the ER doors, rifles raised, demanding one name, Shadow 6. The doctors are frozen. The administrators are screaming. Nobody in this building knows what that name means. Nobody except the limping nurse in the supply corridor, the one everyone ignores, the one they've been pushing around for 3 years. She hears the name and goes completely still. Because Shadow 6 isn't a file, it isn't a call sign on a radio. It's her. And the man dying on that helicopter needs her, right now. If this story already has you gripped, hit follow, like this video, and drop a comment telling me the city you're watching from. I want to see exactly how far this story travels. Let's go. The supply room on the 3rd floor of Silver Valley Medical Center smelled like antiseptic and old cardboard, which was more or less how Emily Carter had come to think of her entire life in this building. She was counting IV bags, 4th time this week, because the inventory system kept glitching and nobody bothered to fix it, and because fixing things nobody else wanted to deal with had become the unofficial job description attached to her name. She set a bag down and flexed her left hand. The fingers were stiff this morning, which meant the barometric pressure had dropped, which meant her left leg would be worse by noon. She'd learned to read her own body like a weather report. Partly cloudy. Pain by midday. Bring the knee brace. She didn't need anyone to tell her how she looked to the rest of the staff. She already knew. 41 years old, a slight drag in her left leg when she was tired, a scar running from her jaw down past her collar that she kept covered with a high-neck scrub top even in August. She moved slower than the other nurses in the mornings. She took the stairs one at a time when her knee locked up. She never ran in the hallways. At Silver Valley, not running was practically a character flaw. Carter. The voice came from the doorway before she'd finished the count. She didn't look up. Stacks off by 6 units, she said. Someone's been pulling from this room without logging it again. Nobody cares about the stack. Dr. Vale wants the OR supply cart restocked before 7. 3rd one, not 2nd. 2nd one's got the wrong suture gauge. The voice belonged to Priya Nolan, a 2nd-year nursing coordinator who was not unkind, just efficient in the way people became efficient when they'd stopped noticing other people. And he said make it fast. He's got a thoracotomy at 7:15. The cart was restocked yesterday. Well, apparently it wasn't restocked correctly. Emily looked up. Priya was already gone. She put the inventory clipboard down, picked up the supply list from the counter, and started pulling what she needed from the shelves. Her hands moved fast even when her leg didn't. That, at least, hadn't changed. Muscle memory from a long time ago, from a version of herself that felt like a story she'd read once about someone else. By 6:50, she had the OR cart restocked, documented, and initialed. She left it outside OR 3 without a word to anyone. At the nursing station on the 2nd floor, she poured herself a coffee from the carafe that was always slightly burnt and sat down to chart the previous night's supply transfers. The ER downstairs was already picking up. She could hear it in the cadence of the overhead PA, the way the announcements were starting to come faster. Tuesday mornings always ran hot. She didn't know why. Nobody did. It was just the rhythm of the building. Did you fix Vale's cart? This from Danny Reyes, an ER nurse who was eating a granola bar at the adjacent workstation with the focused energy of someone who hadn't slept. Done. He's going to find something wrong with it anyway. Probably. Does that bother you? Emily took a sip of the bad coffee. Not especially. Danny looked at her for a moment like he was trying to figure out whether she was admirably zen or just beaten down. She'd gotten that look a lot in the 3 years since she'd joined the staff at Silver Valley. She'd stopped trying to clarify which it was, because the honest answer was complicated, and the complicated answer never went over well in a hospital break room. She'd come to Silver Valley from a gap in her record that she'd explained, when asked, as a medical leave following an injury. That was true. It was just not a complete truth. The complete truth involved things she wasn't permitted to discuss in any detail, and things she didn't particularly want to discuss even if she were, and a period of about 8 months after her discharge that she preferred not to think about at all. What was documented, she had a nursing license, a supply and logistics certification, and a letter of recommendation from a physician at a VA hospital in Oregon who had known her briefly and thought well of her work. What was not documented, The other 12 years. The reason she walked the way she walked. The scar, the call sign. She'd learned to live in the gap between those two versions of herself, and mostly it was fine. The supply work wasn't complicated. The hours were predictable. Nobody asked her to do anything she couldn't do, which was convenient because what she couldn't do, at least officially, was stand in a trauma bay for 6 hours, sprint down a corridor, or drop to one knee to intubate someone on a dirty floor. Or so they assumed. She was finishing her charting when the overhead PA cut through the usual morning hum with something sharper. Attention all staff. Code Orange, Trauma Bay 1 and 2, multi-vehicle incident, Highway 9 interchange, ETA 14 minutes. All available trauma personnel report to the ER immediately. Danny was already moving. Emily stayed where she was for 3 seconds. Not because she was slow, but because she was doing math. 14 minutes. Multi-vehicle. Highway 9 interchange meant the construction overpass, which meant probable crush injuries, possible spinal involvement, blunt abdominal trauma. The ER had 3 trauma-certified physicians on shift. The census was already at 72%. They were going to need extra hands. She finished her coffee, set the mug down, and walked toward the elevator. By the time she reached the ER, the first ambulances were already pulling up. Through the glass doors, she could see the controlled chaos assembling itself. Gurneys being positioned, trauma kits being cracked open, the particular kind of organized noise that happened when trained people ran toward something bad. She pushed through the doors and found an open supply station near Trauma Bay 2, started pulling gloves and prepping the airway cart without being asked. "Carter." The voice stopped her cold. She turned. Dr. Marcus Vale was standing 10 feet away, already gloved, his scrub cap on, looking at her the way he always looked at her, like she was a piece of furniture that had somehow wandered into an inconvenient location. He was 48 years old, chief of surgery, tall in the way that men who expected deference tended to stand tall. He had the kind of face that photographed well and a surgical reputation that was legitimately earned, which made him harder to dismiss than he would have been otherwise. He was also, in Emily's experience, one of the more casually cruel people she had encountered in a professional setting, and she had encountered some genuinely cruel people. "What are you doing down here?" he said. "Prepping the airway cart." "You're a supply nurse." "The cart needs to be ready." "The cart?" He stopped, reassembled himself. "The ER nurses have that handled. I need you out of the bay. There are 2 incoming criticals and 1 probable tension pneumo. The cart wasn't Carter." His voice dropped. Not loud. Vale never needed to be loud. "I don't have time to explain scope of practice to you right now. Trauma Bay is for trauma personnel. You are not trauma personnel. Go back upstairs." She held his gaze for a moment. Not long, just long enough to be noticed. Then she stepped back from the cart, set down the laryngoscope she'd been checking, and moved toward the corridor. Behind her, she heard the ambulance bay doors crash open, heard the first gurney come through, heard the triage nurse calling vitals in the clipped shorthand that meant things were already complicated. She kept walking. In the corridor outside the ER, she stopped and stood with her back against the wall and her hands loose at her sides. Her left knee was aching the way it ached when she'd been on her feet too long, or when she was tense, and right now it was hard to tell which it was. The sounds from the trauma bay came through the closed door in waves. Voices overlapping, a monitor alarming, someone calling for a crash cart. She breathed through her nose, out through her mouth. It was a technique she'd learned a long time ago in a context that had nothing to do with hospital corridors, and it still worked. She was still standing there when Priya came through the side door with a harried expression and a stack of charts. "Why are you out here?" "Vale sent me out." Priya's mouth tightened. "He sent you?" "We have 2 criticals incoming, and he sent the only person who already had the cart prepped." She stopped herself. "Okay, come with me. I need someone who can chart and monitor bed 4. It's a non-trauma admit chest pain needs a sitter." "I can do that." "Yes, I know you can do that, Emily. You can do substantially more than that, but—" Priya stopped again, visibly pulling herself back. "Bed 4. Please." Bed 4 was a 63-year-old man named Gerald, who had chest pain that was almost certainly musculoskeletal, and a deep suspicion that nobody in this hospital was listening to him. Emily listened to him. She took a thorough history, checked his vitals every 15 minutes, and asked him questions that made him feel like a person rather than a problem. By the time his EKG came back clean, he was visibly calmer, and she had 4 pages of notes that the attending on call would find genuinely useful. This was what she did. This was where she lived now, in the spaces between the things she used to be. The code orange ran hot for 2 hours. Through the thin walls of the ER, she tracked it the way she always tracked these things. By sound, by inference, by the way the staff moved past the door to bed 4. She counted 3 criticals, 1 probable surgical case, 2 stable but complicated. She noted when the noise shifted from frantic to controlled, which meant the worst had been triaged. She noted when the overhead PA stopped paging additional personnel, which meant the surge was manageable. By 10:15, the morning had settled into the kind of exhausted normalcy that follows a code orange. Emily finished with Gerald, handed off the chart to the attending, and went back upstairs to inventory. At noon, standing at the break room microwave, she heard 2 of the surgical residents talking in the hallway. Vale was brilliant in there. Caught a grade 3 splenic lac before the patient bottomed out. He's good under pressure. He's good, period. I just wish he wasn't such a pause. A dropped voice. Yeah. Emily took her food from the microwave and sat down and thought about nothing in particular. At 2:47 in the afternoon, the windows in the break room rattled. It wasn't an earthquake. The sound was different, rhythmic and approaching, mechanical, the kind of percussion that came from large rotors operating close to the ground. Emily set down her fork and tilted her head and felt something in her chest do a slow, specific turn that she hadn't felt in a very long time. She was at the window before she'd made a conscious decision to stand up. 4 helicopters. Black, no visible markings from this distance, coming in low and fast from the south in a formation that was not a medical transport formation. She knew what medical transport formations looked like. She knew what this formation looked like too. They came in over the tree line and descended toward the parking lot with a practiced efficiency that cleared 3 rows of parked cars through sheer noise and downdraft. People were already running from their vehicles. The helicopters didn't slow down for that. They never did. Emily was already moving. She hit the stairwell and went down 2 flights. Not running exactly, but not careful either. Her knee protesting, and she was ignoring it, pushing through the door to the first-floor corridor just as she heard the main ER entrance explode with noise. She came around the corner of the corridor and stopped. There were 8 of them in the ER doorway. Marines, full combat kit, rifles at low ready, moving with the kind of coordinated purpose that civilian spaces were not designed to contain. The ER staff had frozen. Patients in the waiting area had gone very still. Behind the intake desk, the charge nurse was on the phone, her voice a controlled attempt at calm that wasn't quite holding. One of the Marines, Master Sergeant by the rank insignia, a broad man with a jaw like a cinder block and the flat effect of someone who had stopped being surprised by anything years ago, swept his gaze across the room and said, loud enough to carry over the ambient noise, "I need to speak with whoever's in charge, now." The charge nurse lowered her phone. "That would be Dr. Vale. He's—" "Get him." She got him. Vale appeared from the direction of the surgical suites 2 minutes later, still in his scrub cap, and the Marines registered him with the particular expressionless assessment of people who were measuring worth in very specific terms. "What is this?" Vale said, and to his credit his voice was steady. "Master Sergeant Leon Dre, USMC." The big Marine didn't offer a hand. "We have a critical patient incoming, Watts. One of ours. He needs immediate surgical intervention. We are requesting full facility cooperation." "This is a civilian hospital, Sergeant. We have protocols. I'm aware of your protocols, Doctor. My patient doesn't have time for your protocols." Something shifted in the room. Emily was still in the corridor, partially visible through the glass partition, and she watched it happen. The particular moment when Vale registered that this was not a conversation he was going to win by invoking hierarchy. "What are we dealing with?" he said, his voice shifting into something more practical. Dre looked at him for a moment. Then he looked at the charge nurse. Then his gaze swept the room and came to rest, through the glass, on Emily. He went still. Then he said very carefully, "Before I give you a patient briefing, I need to ask you something. Your staff." He looked at the charge nurse. "Do you have a nurse here? Or someone working in any capacity here who goes by Emily Carter?" The charge nurse blinked. "We have an Emily Carter on the supply nursing staff, yes." Dre's expression didn't change, but the Marine to his left, younger, a corporal, exhaled sharply through his nose like he'd been holding his breath. "I need to see her," Dre said. "Right now." Vale's eyes narrowed. "Why does a Marine combat unit need to speak with my supply nurse?" Dre turned to look at him with the measured patience of someone who had already decided this person wasn't relevant to what came next. "Because," Dre said, "we're not looking for your supply nurse." He turned back toward the glass partition, toward the corridor where Emily was standing, and his voice, when he spoke again, was different, lower, more careful, freighted with something that had been carried a long way. "We're looking for Shadow 6. The words landed in the room like something physical. Emily stood in the corridor and did not move. She watched Dre's face through the glass, and she saw in it things that she recognized: the tight-held control, the urgency masked by training, and underneath both of those, something raw that wasn't either. The particular expression of a soldier who has run out of options and has arrived at the last door. She pushed through the door into the ER. Vale turned, saw her, and started to say something. Her name, probably, or a question, the tone of a man who is about to demand an explanation. She walked past him. She stopped in front of Dre. He was 6 feet and change. She was 5'7". They were almost exactly the same age, she realized, looking at him up close. She didn't know him, but she recognized the unit patch on his shoulder. "Who's down?" she said. Dre studied her face for a second and a half. "Colonel James Vero. IED strike during a joint training exercise with a foreign unit, classified location. They got him out, but..." He stopped, recalibrated. "There's a secondary device. Embedded. It did not detonate." The room around her had gone completely quiet. "Embedded where?" Emily said. "Left thoracic cavity, below the subclavian, above the 5th rib. The EOD team confirmed. It's live. They couldn't extract it in the field. The colonel is alive, but you couldn't fly him to a military facility without risking detonation from altitude pressure changes," Emily said. Dre looked at her. "Yes. And your on-base surgical team doesn't have the combination of skills for this." He paused. "We need someone who can do trauma surgery and work directly with EOD during extraction. Someone who has done that before." Vale stepped forward. "I am the chief of surgery at this facility, and I have..." "We need Shadow 6, Dre said, and he said it directly to Emily, not to Vale, as if Vale weren't standing 3 feet away. "Command flagged her 3 hours ago. Her record shows she's in this city. We traced her to this hospital." He took a breath. "Ma'am, we know who you are." Emily looked at him. Behind her, she could feel Vale's confusion hardening into something else. Not just confusion, but a specific dawning recalculation that she had seen on other people's faces before and never particularly enjoyed. "Tell me about the device," she said. "M67 variant, modified. EOD specialist on the bird has confirmed non-movement detonation risk is low, as long as we control the surgical field. They have tools. They need a surgeon and a medic who can work alongside them in a simultaneous extraction." Vero's fast exam results? Hemothorax left side. BP was 90/60 on the bird, dropping. The corpsman has 2 lines in. His rhythm? Sinus tach, rate of 110. Emily's mind was already running the sequence. Not consciously. It happened beneath language, in whatever part of her had never actually stopped being what she was trained to be. She could see the surgical field. She could see where the device was sitting, where the vessels were, what the order of operations needed to be, what would kill him before the device did if they weren't precise. She became aware that she had stopped thinking about her knee entirely. "Where is he?" she said. 1 minute out, Dre said. "The helicopter is circling." She turned. Vale was staring at her with an expression that was not, for once, contemptuous. It was something else, something between disbelief and the first stirrings of a recalculation that he did not look happy to be making. "Vale," she said, and her voice came out different than it usually did in this building. Steadier, lower, the voice she used when things were happening that couldn't wait. "I need OR1 prepped. I need your best scrub tech, a full thoracic kit, and I need your anesthesiologist in that room in 4 minutes. And I need the room cleared of everyone who hasn't worked with explosive ordnance before." Vale blinked. "You're a supply nurse." "I know what you think I am," Emily said. "You have about 50 seconds to decide whether you're going to keep thinking it." Outside, through the ER's trauma bay windows, the sound of rotor wash suddenly filled the air as the 5th helicopter, the transport bird, came in low and fast over the parking lot, its landing lights blazing white in the gray afternoon. And through the window, Emily could see the medics on board already working over a figure on the litter inside, their hands moving with the frantic precision of people trying to hold something together that kept trying to come apart. She turned back to Dre. "Get him inside," she said. Dre was already moving before she finished the sentence, his hand going to his radio, his voice dropping into the clipped cadence of someone relaying orders that needed to happen yesterday. The 2 Marines flanking him peeled off toward the ambulance bay doors, and through the glass, Emily watched the transport helicopter settle onto the parking lot asphalt with the kind of controlled aggression that only military pilots managed. Fast, precise, no wasted motion. Vale hadn't moved. She turned to look at him and saw the precise moment when he made his decision. Not the right decision, not yet, but the decision to at least stop blocking. His jaw was tight. His eyes were moving over her face like he was looking for something he could use to reassert the order of things. "OR1 is already in use," he said. "Then clear it." "Emily, Dr. Vale." She kept her voice even. This was not the time to be satisfying about it. "That man has a live device in his chest, and he has maybe 20 minutes of viable BP before we lose the window. Clear the room or step aside and I'll find someone who will." A beat. 2. "Priya." Vale didn't look away from Emily when he said it. "Get OR1 cleared. Pull whoever's in there into 2 and 3. Do it now." Priya, who had appeared from somewhere during the confrontation and was standing near the nurse's station with her tablet pressed to her chest, was already moving. Emily went to the sink and started scrubbing before OR1 was technically cleared, because she knew it would be by the time she needed it to be. Behind her, she heard the ambulance bay doors crash open and the controlled chaos of the litter team coming through. Boots on tile, the hollow percussion of gurney wheels, a corpseman calling vitals in the flat cadence of someone who had been calling vitals in bad situations for a long time and had developed a specific kind of calm that was not the same as being okay. "BP 82/58, rate 117, OSAT 91 on high flow." She turned. Colonel James Varro was 40-something, she guessed, though right now the only useful thing about his age was what it told her about probable vessel integrity. He was large, broad-shouldered, heavily muscled, the kind of body that had spent decades being treated as a tool. His face was gray. His eyes were open and tracking, which was something. A corpsman had both hands on a pressure dressing on his left side, and through the dressing, Emily could see the specific color that meant hemothorax was progressing. She moved to the gurney. "Colonel Varro," she said clearly. His eyes found her. There was pain in them, and effort, and the distant quality of someone spending a great deal of energy on staying present. "I'm Emily Carter. I'm going to take care of you." She had her fingers on his wrist before she finished the sentence, feeling the pulse. Weak, fast, thready, in the way that meant his pressure was worse than the cuff was showing. "Stay with me." His lips moved. She leaned closer. "Shadow 6, he said. His voice was a wreck. Air and blood where there shouldn't be either, but there was something in it, not a question. "Yeah," she said quietly. "I've got you." They moved. The corridor between the ER and OR1 was 43 feet. She'd walked it hundreds of times, had cataloged every turn and doorway and floor drain, the way she'd always cataloged spaces. Out of habit, out of training, she'd never been able to fully turn off. Now she moved alongside the gurney and tracked the monitors the corpsman carried and did triage math in her head that ran parallel to and entirely separate from the conversation happening around her. EOD specialist Garrett Kane was waiting outside OR1. She registered him before he spoke. Late 30s, compact, the specific stillness of someone who worked with explosive materials and had learned that stillness was the most important tool he had. He was carrying a case that she recognized on sight. "Carter?" he said. "Kane?" "Yes, ma'am." He looked at the case, then at her. "I need to brief you on the device before we open. You've got 30 seconds. Walk with me." He walked with her, speaking in a low, precise voice that contained no unnecessary words, which she appreciated. M67 variant, as Dre told you. Somebody modified the fusing mechanism, made it pressure sensitive rather than impact. What kept it from going off during the blast was probably positioning. It was partially shielded by his plate carrier. What keeps it from going off now is that it's surrounded by soft tissue that's absorbing micro-movement. But the hemothorax is expanding, Emily said, and as the blood accumulates, it's going to shift the device. Kane looked at her. "Yes. What's your extraction plan?" "We need the surgical field clear before I go in, meaning the hemothorax has to be evacuated, the active bleeding controlled, and then I need about 4 minutes of complete stillness in the chest cavity to extract without triggering the pressure sensor. Your job is everything up to that point, and then holding the field steady while I work." "The subclavian?" "Device is sitting approximately 2 centimeters inferior. If there's any arterial bleed during my extraction, I'll have a clamp on it," Emily said. Kane stopped walking. She didn't. He caught up. "You've done this before," he said. "Get your gear into OR1. Damn." The room was not fully cleared when she walked in. A surgical resident named Torres, mid-20s, good hands, she'd seen him work twice from across a room, was still at the sink, and the scrub tech, a woman named Patel, who'd been at Silver Valley 12 years and had the unflappable quality of someone who'd seen everything, was laying out the thoracic tray with the focused efficiency of someone who had been given very little time and was not panicking about it. Good. She could work with this. "Torres," Emily said, "you're second hand. If you get a directive from me you don't understand, you follow it first and ask second. Can you do that?" Torres looked at her scrubs, her supply badge still clipped to her collar, her leg that had developed the particular stiff quality it developed when she'd been ignoring it for too long. "Dr. Vale isn't—" "Torres." Something in her voice reached him before his doubt could finish assembling itself. He straightened. "Yes," he said. "Good." She turned to the anesthesiologist, Dr. Wen, mid-50s, silver-haired, who was checking his lines with the unhurried precision of someone who had decided that unhurried precision was the only appropriate response to whatever was happening in this room. "Wen, I need him under, but I need him at the lightest safe plane you can manage. Any drop in pressure and I need to know instantly." "Understood," Wen said without looking up from his work. The team brought Vero in and transferred him to the table, and for the 30 seconds that took, the room was full of people moving and equipment shifting and the overlay of monitor tones, and then it settled, the way a room settled when something real was beginning, when all the noise compressed into focus. Emily positioned herself at the left side of the table. Her hands were steady. That was always the last thing to go. Not confidence, not knowledge, but the hands. She discovered that young, and it had defined a lot of what came after. She looked at the monitors, she looked at the entry wound and the pressure dressing, she looked at Kane, who had positioned himself to her right with his case open, his tools laid out with the neat precision of a person whose margin for error was absolute zero. "On your call," he said. Emily took one breath. "Inside," she said. What happened in OR1 over the next 22 minutes was not visible to anyone outside it, but what was visible was the rest of Silver Valley Medical Center responding to the fact that it was happening. In the corridor outside the OR, Master Sergeant Dre stood with his back against the wall and his arms crossed and his eyes on the closed door. He didn't pace. He didn't check his phone. He'd sent his junior Marines to secure the perimeter of the building's exterior, not because there was an active threat, but because that was the thing to do with Marines who needed something to do. And he was now doing the only thing left to him, which was waiting. In the hallway behind him, Dr. Marcus Vale was not waiting. He was pacing in the specific way of someone who was used to being the most important person in a given space and was finding it intolerable not to be. This is completely outside protocol, he said. She isn't credentialed for surgery. Whatever that woman is doing in there, Dre said, without turning around, is the only reason Colonel Vero has a chance. She is a supply nurse. She has no surgical privileges at this facility. If something goes wrong, Dre turned. He didn't raise his voice. He didn't need to. He had the particular quality of stillness that made raising voices unnecessary. Dr. Vale, he said, I'm going to need you to go find somewhere else to stand. Vale opened his mouth. That wasn't a suggestion. Vale closed his mouth. The muscle in his jaw moved. He looked at Dre for 3 seconds, then at the closed OR door. Then he turned and walked down the corridor, and the sound of his footsteps was the sound of a man trying to maintain dignity while retreating. Dre turned back to the door. Inside or Emily had the chest open. The hemothorax was worse than the imaging had suggested. Almost 800 milliliters by her estimate, blood filling the left pleural space with the dark, non-arterial look of ooze from multiple disrupted vessels rather than a single clean bleed. She evacuated it systematically, Patel suctioning alongside her, Torres holding retraction without being asked twice. Wen was calling pressure every 90 seconds, which was what she'd asked for and what she needed. 68/44, Wen said. I see it. She had her left hand inside the chest cavity, and she could feel the device, not directly, but through the tissue around it, the slight wrongness of something that wasn't supposed to be there, hard and geometric, in a space built for soft and organic. She did not touch it. Bleeding source, Torres, retract left. He did. She found it. A disrupted intercostal vessel, bleeding slow and consistent, the kind of bleed that wouldn't kill you in 10 minutes, but would kill you in 40. She got a clip on it. The flow stopped. Kane, she said. Ready? Give me 30 seconds. She did what the next 30 seconds required. Controlled, systematic, not fast, not slow. The pace of someone who had learned that precision was faster than speed in the end. She controlled the field. She checked the subclavian. Intact, no involvement. Margin was better than Kane had estimated from the imaging. She positioned her clamp. Field is yours, she said. Kane moved in. She had never worked alongside an EOD specialist in a hospital operating room before. She had worked alongside them in field conditions. A dirt floor, a headlamp, the sounds of a situation happening not far enough away outside. The hospital felt different, but the dynamic was the same. His world, his expertise, her job to make the space safe enough for him to use it. She held. She held with everything she had, which was not nothing. Her hands had been trained for stillness, the way other people's hands were trained for speed. She could feel every tremor that tried to arrive through her wrists, the fatigue, the strain of the position, her left shoulder protesting the angle, and she filtered them out, one by one, the way she'd been taught to filter noise out of a signal. 30 seconds, Kane said quietly. She breathed. 60. The monitor tone stayed steady. Wen was silent, which meant the pressure wasn't dropping. 90. Kane's hands moved in a way that she could not see directly, but could track through changes in the tissue resistance she was feeling against her palm. I have contact, he said. Nobody in the room breathed. Separating attachment. 11 seconds. Clear. He lifted the device from the chest cavity, held it with both hands, a small, ugly, entirely ordinary-looking piece of metal that had no business being inside a human body, and placed it in the sealed containment unit his second had ready at the edge of the table. The containment unit clicked shut. Emily let out the breath she'd been holding in controlled increments for the last 4 minutes. BP? She said. 71/48, Wen said, but trending up. Good. She looked at the surgical field. She had work left to do. The closure, the drain, the chest tube, and she did it without commentary, methodically, Torres anticipating her needs well enough that she only had to redirect him twice. By the time she was placing the final sutures, Vero's pressure had climbed to 84/56, and his oxygen saturation was 95%. Not good, not yet, but survivable, which 22 minutes ago he hadn't been. She stepped back from the table. Her hands were shaking. Not during, never during, but after was its own thing, and she'd learned not to fight it. She pressed her palms flat against her thighs and stood very still for a moment. "Good work," she said to the room, and she meant it. Patel nodded once, efficiently. Torres exhaled through his mouth and looked like he might need to sit down. Wen was already adjusting his lines, watching his monitors, doing the quiet arithmetic of keeping a man alive through the next hour. Kane was securing the containment unit. He looked up at her. "That's the cleanest field I've ever worked in," he said. Emily peeled off her gloves. "Don't tell me that. Makes me nervous." He almost smiled. "Copy that." She pushed through the OR door. Dre was still in the corridor. He looked at her face, and something in his own face shifted. Not relief exactly, but the recalibration of someone who had prepared for a different outcome and was now adjusting. "He's alive," Emily said. "BP is stabilizing. He'll need ICU monitoring for at least 72 hours, and there are bleeders I controlled but didn't fully repair. He'll need a second look in 6 to 8 hours. But he's alive." Dre closed his eyes for exactly 2 seconds. Then he opened them. "Thank you," he said, and the word had weight in it, the kind of weight that came from things that didn't have other words. "Tell me he's going to make it," Emily said. "He's going to make it. Then we're square." She turned to find her way to the post-op area and nearly walked into Marcus Vale. He was standing at the corridor junction 15 feet away, where he must have circled back from wherever Dre had sent him. He was looking at her with an expression she'd never seen on his face. Not quite disbelief, not quite anger, but something between them that hadn't finished becoming either. "My office," he said. "When you're done." "I'm done now," Emily said. "Then now." She followed him. Vale's office was on the second floor, corner room, window overlooking the parking lot where, Emily noticed as she walked in, the Marine helicopters were still sitting. She wondered if the downstairs staff had gotten used to them yet. Probably not. Vale closed the door and turned and looked at her and did not, for once, begin with an insult. "Who are you?" he said. "You know my name. I know your name on my supply roster. I know that you've worked in this building for 3 years and I have never once—" He stopped. "You just performed a thoracic surgery alongside an EOD specialist. In my hospital, without surgical privileges, without anyone dying," Emily said. "That is not the point. It's the only point that matters in a hospital. You're not cleared for surgical work at this facility." His voice was climbing. She could see him trying to keep it level and not quite managing. "What you just did is a liability issue. It's a credentialing issue. It is potentially a criminal. Vale." He stopped. "Colonel Varro is alive," she said. "The device has been safely extracted. Your OR team did their jobs. Nobody is dead, and nobody is going to be dead tonight because of what happened in that room." She met his eyes. "Whatever questions you have about my credentials, I'm sure you can find the right people to answer them. The Marines brought paperwork. They usually do." Something in his face shifted again. The same recalculation she'd seen before, moving further this time, toward a place he clearly didn't want to go. "Those Marines are going to want to debrief you," he said. "I know." "And after that debrief, I know," she said again. She reached up and unclipped her badge from her collar. She looked at it for a moment. The Silver Valley logo, her name, the word supply in small letters below it. She'd worn it for 3 years. It had never felt like it fit. She set it on his desk. "I'll have my formal statement to HR by morning," she said. She was almost at the door when his voice stopped her. "Carter." A pause. She didn't turn around. "How long?" She knew what he was asking. "Long enough," she said. She walked out. In the corridor, moving toward the elevator with her limp that was worse now, genuinely worse, the kind of worse that came from standing in a fixed position for 22 minutes with your weight distributed wrong. She passed the nursing station where Priya was standing, and Priya looked at her, and something moved across Priya's face that was not the usual efficient neutrality. "You okay?" Priya said. "Fine." "You don't look fine." "My knee's acting up." Priya looked at her for a long moment. "I saw you go into that OR," she said carefully. I saw you come out, and I've been trying to figure out. I've been watching you for 3 years, Emily, and I never. Priya. Yeah. I need to find Dre. He's in the waiting area near the main entrance. Priya watched her. He's been on his radio. Emily nodded and moved toward the elevator. When it opened on the first floor, Dre was there, and he wasn't alone. Standing with him was a man she didn't recognize. Civilian clothes, mid-50s, the particular posture of someone who spent a lot of time in rooms where decisions were made. He had a government ID clipped to his jacket that she clocked from 6 feet away, and when he saw her, he straightened with the alertness of someone who had been waiting for something and had just identified it. "Carter," Dre said. His voice had a different quality now. Careful, the way it got when there was a third party involved who changed the parameters. "This is Deputy Director Harland of the Defense Intelligence Review Board." Harland extended a hand. She shook it. "Ms. Carter," he said. "Or should I say, Carter's fine," she said. He studied her face. "I think we need to talk." "About Varro." "About everything," Harland said. "About your record. About what you've been doing for 3 years in a supply closet in this hospital." He paused. "And about the fact that 2 hours ago, your commanding officer's last request before he went under anesthesia was that we find you." He reached into his jacket and produced a folded document. "He signed this in the helicopter, on the way in." He held it out. She took it. She unfolded it. Her eyes moved across the page, and something in her chest did something complicated. Not quite pain, not quite relief, not quite anything she had a clean word for. She read it twice. Then she folded it again and held it at her side. "What does that change?" she said. "Quite a lot, actually," Harland said. Behind him, through the glass doors of the main entrance, she could see the parking lot and the helicopters and the Marines moving with their specific economy of motion, and beyond all of that, the gray afternoon that had somehow become a different afternoon than the one she'd woken up in. "I need 20 minutes, she said. "I need to check on my patient." "Of course," Harland said. She was 3 steps away when she heard it, Dre's radio, crackling with the sharp, compressed cadence of someone transmitting under pressure. She stopped. Dre had the radio to his ear. His face had changed in the way that military faces changed when something had gone wrong, and gone wrong specifically in the way that required immediate action. "Say again, Asu," he said into the radio. A pause. "Say again, confirm." Static. Then a voice, broken but audible. "Second device," the voice said. "EOD found a second device. It's not in the patient. It's... Dre, it's on the containment unit. Someone modified the containment unit before transport. If that case is opened..." Dre's eyes went to Emily. "Where's Kane?" she said. "He took the unit to the hospital's secure storage room," Dre said, and she was already moving before he finished the sentence, already moving down the corridor at the fastest pace her body currently allowed. Her knees screaming, and she was ignoring it completely, because Kane was in a room somewhere in this building with a container that was about to kill him. The secure storage room was in the basement, which meant she had to get to the basement, which meant the stairwell at the end of the corridor because the elevator was too slow, and she already knew that. She hit the stairwell door with her shoulder and went down, one hand on the rail, her left knee doing something it hadn't done in a while, locking on the down step, forcing her to drop her weight to the right, which threw her rhythm off, which slowed her down. She didn't stop. She adjusted and kept moving the way she'd always moved when her body was arguing with her, which was to negotiate the argument down to a manageable complaint and ignore the rest. Dre was behind her, faster on the stairs, catching up. "Kane doesn't know," she said without looking back. "I'm trying to raise him on radio. He's not responding. Basement storage has thick concrete walls. Radio won't penetrate." "I know." She pushed through the basement door. The basement of Silver Valley was a long, low-ceilinged corridor that smelled like cleaning chemicals and old pipe insulation, lit by fluorescent tubes that buzzed at a frequency she'd always found mildly irritating. She'd been down here maybe a dozen times in 3 years. Supply deliveries, once a maintenance issue with the pharmaceutical storage lock. She knew the layout. Secure storage was at the end of the east corridor, behind a keypad door. She moved fast. Dre was on her left, his radio still crackling with the broken signal that wasn't getting through to Kane. The modification on the containment unit, she said. What exactly did EOD say? Pressure sensor on the latch. Open the case. The circuit closes. Dre paused. It would take out anyone within a 12-foot radius. She turned that over as she moved. The storage room was small, maybe 10 by 12. Kane opening the unit in there meant, who had access to that containment unit between extraction and transport, she said. It was in OR1 for approximately 4 minutes after extraction, then Kane brought it out. Who was in OR1 during those 4 minutes? Dre didn't answer immediately, which meant he was thinking through the same list she was. She reached the keypad door. It was closed. The lock light was green. Someone had entered recently, and the door had resecured behind them. She punched her code. She had access from a supply authorization that had never been rescinded, and pushed through. The corridor beyond was shorter. The storage room door was on the right, partially open, a line of light showing at the edge. "Kane!" she called, keeping her voice controlled. Loud enough to carry, not loud enough to startle. Sounds from inside. Movement. Then Kane's voice. "Carter? What are you—" "Don't open the case." A pause. 3 full seconds. "What?" She was at the door. She pushed it open with her palm flat, not touching the frame, not touching the door, a reflex from training that her hands remembered even when her brain hadn't consciously recalled it, and stepped inside. Kane was standing at the steel work table in the center of the room. The containment unit was in front of him. His hands were on the latch. Not pressing, not yet, but on it. "Step back from the table," Emily said. Kane looked at her. His face ran through several expressions in quick succession. Confusion, assessment, the particular stillness of an EOD specialist who has just been told there is a problem with the device and is now running probability calculations. He stepped back. "Talk to me," he said. "Secondary device. Pressure sensor on the latch. Someone modified the unit before transport." Kane looked at the containment unit. He looked at it the way she'd seen surgeons look at unexpected findings in an open chest. The rapid recalibration, the reconstruction of everything they thought they knew about a situation. "When?" he said. "Between OR1 and here." "That's a 14-minute window." "I know." He moved toward the unit, not to touch it, just to look. She understood. She'd have done the same thing. Looking wasn't touching. Looking was information. "If it's a pressure sensor on the latch, it's a contact trigger," he said, half to himself, "which means the device inside is probably—" He stopped. The original device was the delivery system, not the payload. The sentence landed in the room with a specific weight. Dre, behind Emily, said, "Meaning the M67 variant we pulled from Vero wasn't the primary threat." "It was the distraction," Kane said quietly. "Get us focused on the patient, get the containment unit into a secure location, then someone opens the case to log the device for evidence," and he didn't finish. Emily was already thinking past it. The unit was in OR1. Who had access to OR1 in that window? OR team was still in the room for cleanup, Dre said. Patel, Torres, Wen, 2 of my Marines who were posted outside, and he paused. "Who else?" Dre's jaw tightened. "Vale came in during post-op. I saw him come through the door. I assumed he was checking on the patient." The room went quiet. Emily didn't say anything for a moment. She was running the logic and finding it both possible and incomplete. Possible because the access was there. Incomplete because Vale, being an idiot, didn't automatically make him a saboteur. There was a gap between those two things, and she didn't have time to fill it right now. "The unit needs to be rendered safe," she said. "Kane, can you do that without triggering the secondary?" "If the sensor is on the latch, yes, but I need my full kit and I need this room cleared of non-essential personnel." "Define non-essential." "Anyone who isn't me." She looked at him. "I stay." "Carter?" "I stay," she said again, and her tone closed the conversation. Kane looked at Dre. Dre looked at Emily. "I'll be outside the door," Dre said, and there was something in his voice, not resignation, but a kind of trust that had been extended and accepted. And he left the room. What followed was the kind of work that reduced the world to a very small space. Kane opened his field kit and began laying tools in the order he'd need them, and Emily watched him work with the focused attention of someone who was prepared to hand him anything he asked for and needed to know where everything was before he asked. The room was quiet except for the buzz of the fluorescent tube and the sound of Kane's breathing, which was slow and deliberate in the way she recognized as controlled, not calm. "Tell me what you're doing as you do it," she said. "You want a running commentary on EOD work? I want to know what's happening so I can anticipate. It's how I work." A beat. "Fair enough." He picked up a tool she recognized as a fiber optic probe, slender, flexible, designed to go into small spaces without triggering contact sensors. "First step is confirming sensor placement. If it's exactly on the latch, I have options. If it's anywhere else on the unit, then the options change significantly." He positioned the probe at the edge of the latch housing. "Hold the light. There. Angle it about 15 degrees left." She held it. He worked in silence for 90 seconds. She watched his face, not the probe. His face would tell her what she needed to know faster than trying to read the technical work she couldn't fully see. "There," he said. "Sensor is on the latch, as reported. Contact type looks like a simple circuit closure." He pulled the probe back slowly. "Good news is it's not sophisticated. Bad news is unsophisticated devices are sometimes less predictable." "What do you need?" "A bypass lead and about 4 minutes of very steady hands." "I have steady hands," Emily said. He looked up at her. "I know you do." He reached into the kit. "Hold this." She held it. The next 4 minutes were the kind of 4 minutes that she would not be able to fully reconstruct later. Not because she lost focus, but because focus at that level flattened time into a series of precise moments without the connective tissue of normal awareness. She registered each step as Kane talked her through it. The bypass lead positioned across the circuit, the probe maintaining separation, the careful incremental pressure that would allow the latch to disengage without completing the trigger connection. Her hands did not shake. They had an argument with her about it. She could feel the fatigue in her forearms, the strain in her wrist from the angle, the accumulated load of a day that had asked her hands to do things she hadn't asked them to do in years. But they did not shake. "Contact maintained," Kane said. "Disengaging latch, now." The latch opened. No sound. No pressure wave. No sudden brightness. Kane let out a breath through his teeth. "Clear," he said. Emily lowered her hands and let them hang at her sides and allowed herself 3 seconds of nothing before she put her attention back on the room. The containment unit was open. Inside, the modified M67 variant sat in its foam housing, and below it, Kane was already examining it, a secondary device, small, flat, pressed into the base of the foam, triggered by latch contact, clean assembly, which meant someone who knew what they were doing. "This wasn't improvised," Kane said. "No," Emily said. "This was planned, before we even brought Varro in." He sat back on his heels and looked at the device with an expression that was trying to be professional and was not entirely succeeding. "Someone knew we were coming here." Emily was already at the door. "Dre," she said. He was in the corridor where he'd said he'd be. She could tell from his face that he'd heard at least some of what had happened, or had inferred it from the absence of an explosion. "It's safe," she said. And Kane's right. This was pre-planned. Whoever modified that unit knew the mission parameters, knew we'd be coming to this hospital, knew Varro would need surgery, knew the device would be extracted and contained. She looked at him. "That's an intelligence leak. Inside the operation." Dre's face did the military thing it did when information arrived that was bad in multiple simultaneous directions. "I need to make a call." "Make it," Emily said. "And while you do, I need to know who was in contact with the mission timeline before we arrived here." "That's a short list." "Good." "Carter." Dre caught her arm as she started to move, not grabbing, just a contact, enough to pause her. "Harlan needs to know about this." "I know. Where is he?" "First floor waiting area." She moved toward the stairs. The stairwell on the way up was worse than on the way down. Going up put different demands on her knee than going down. A different set of muscles, a different load distribution. And what she'd been asking of her body over the last 2 hours had spent the credit she normally relied on. By the time she reached the first floor, she was limping noticeably enough that a passing orderly glanced at her with the particular look of someone who was about to ask if she needed help. She kept moving. Harland was where Dre had said he'd be, seated in the main waiting area, one leg crossed, phone to his ear. He saw her come through the door and ended his call before she reached him. The containment unit had a secondary device, she said. Kane rendered it safe. It was pre-placed. Someone with knowledge of the operation timeline modified that unit before transport. Harlan absorbed this without visible surprise, which was itself informative. You suspected, she said. We had indicators, he said carefully. Not confirmation. He stood. Are you telling me there's a source inside the operation? I'm telling you the modification required operational knowledge. What you do with that is your department. She met his eyes. But while you're working that problem, I have a different one. Someone inside this hospital may have had access to that containment unit during a 14-minute window post-extraction. I need to know what you know about Marcus Vale. Harlan's expression changed in a way that was very small and very specific. Why? He said. Because he was in OR1 during that window. Because his behavior today has been off in ways I can't fully account for with arrogance alone. And because whoever modified that unit knew enough to make it look like standard equipment. She paused. Vale has military consulting experience. It's in his file. I read his file when I took this job. Force of habit. You read the personnel files when you were hired as a supply nurse. I read everything when I'm somewhere new, Emily said. It's a hard habit to break. Harland looked at her for a long moment. Then he reached into his jacket and produced his phone. He made 2 thumb movements, opening something, not making a call, and handed it to her. The screen showed a document, a personnel cross-reference. She read it fast, the way she'd been trained to read documents, absorbing structure before detail, then filling in detail on the pass back through. 3/4 of the way down the page, she found it. Dr. Marcus Vale. Defense Contractor Consultation, 2019 to 2021. Program designation, classified. Contracting party? Meridian Strategic Group. She looked up. Meridian, she said. Meridian Strategic Group was dissolved by federal order in 2022, Harlan said, following an investigation into unauthorized weapons brokering. Several of their assets were never fully identified. The word assets sat between them with its full weight. Emily handed the phone back. Her mind was running the sequence. Vale's behavior throughout the day, not just the professional contempt she'd gotten used to, but the specific moments. His presence in OR1, his immediate pivot to administrative action after Vero was stable, his attempt to remove her from the situation as quickly as possible. She'd read it as ego. It might have been more deliberate than that. Where is Vale right now? She said. Harlan's expression shifted. It was a small shift, but she'd been reading small shifts in people's faces for a long time. That's the other thing I was about to tell you, he said. We had a Marine posted at the surgical suite entrance. Vale told the Marine he needed to check on a post-op patient, and the Marine let him through. A pause. That was 11 minutes ago. He hasn't come back out. Something cold moved through Emily's chest. Varro is in post-op, she said. She was already moving. The post-op unit was on the 2nd floor, east wing. She knew the path without thinking about it, had walked it hundreds of times carrying supplies, had memorized the floor plan the way she'd memorized every floor plan in this building without ever quite deciding to. She took the stairs again because the elevator was still too slow and her knee was not her primary concern right now. She came through the 2nd floor stairwell door and moved fast down the corridor and pushed through the post-op unit door and stopped. The Marine posted inside the unit was on the floor, not unconscious, sitting against the wall, hand pressed to the side of his head, blood between his fingers from a laceration above his ear. He was conscious, his eyes tracking, but he was down, and that was enough to tell her what kind of 20 seconds had just happened. Room 4, the Marine said, and his voice was tight with pain and something that might have been anger at himself. I didn't see... She was already past him, moving down the unit corridor, past rooms 1, 2, 3, Room 4. The door was closed. She didn't stop to think about whether she should knock or announce or wait for backup. She pushed the door open. Vale was inside. He was standing at Vero's bedside with his back to the door, and his right hand was on the IV line, not adjusting, not checking, but at the junction where something could be introduced into the medication port, and in his left hand was a syringe. "Stop," Emily said. Vale turned. His face in the first second after he turned was the face of someone who had been caught in a way that confirmed everything, and for a moment, just a moment, the professional composure that had defined every interaction she'd had with him collapsed completely, and she saw what was underneath it. "You don't understand what's involved," he said. "Put the syringe down." "This is—" He stopped. Something in his expression recalculated. "You're a nurse, you're not armed, and that door doesn't lock from the outside." His hand moved toward the port. Emily crossed the room in 3 steps and put herself between him and the IV line, her back to Vero's bed, her eyes on Vale. "I know exactly what Meridian asked you to do," she said. "I know what you are, and I know that syringe has about a 4-second window of usefulness for you before the Marine in the hallway calls for backup, and this room has 6 people in it." She kept her voice level. "Put it down." Vale looked at her. His breathing was wrong, too fast, too shallow, and his hand was not as steady as a surgeon's hand should be. She filed that away. "Useful. You were nobody," he said, and the contempt was back, but it was different now. Defensive, the contempt of someone trying to reassemble authority they no longer had. "You were a supply nurse with a bad leg. That's all I was ever told you were." "And yet here we are," Emily said. His eyes dropped to her hands. She was watching his, the syringe hand specifically, tracking the micro-movements that would telegraph whether he was going to comply or rush. The same way she'd tracked a dozen situations where the variable was whether someone was going to do something stupid in the next 3 seconds. He rushed. Not at her. At the door. A sudden lateral move that was fast enough to tell her he'd been thinking about it for longer than the last 2 seconds. She'd anticipated lateral. She'd been standing slightly off-center for exactly that reason. She caught his wrist, the syringe hand, with both of hers and used his momentum against him, redirecting rather than stopping, a technique that her body remembered more cleanly than her knee appreciated. The syringe skittered across the floor. Vale went into the wall with the controlled impact of someone who'd been redirected by someone who knew what they were doing, and for a moment they were both still. Her hands on his wrist, his shoulder against the wall, both of them breathing hard. The door opened. Dre. And behind him, 2 Marines and Harland, and the corridor suddenly full of the particular energy of a situation that had just shifted from emergency to contained. Vale went still under her hands. She let go and stepped back. Her knee chose that moment to make its most emphatic protest of the day, and she put a hand on the wall to keep her balance and stayed there for a second, just breathing, while the Marines moved past her and Dre stepped to her side. "You okay?" he said quietly. "Ask me in an hour," she said. On the bed behind her, the monitors showed Vero's vitals still holding, pressure 88/60 and climbing, rhythm steady, oxygen saturation 96%. He'd slept through the entire thing, which she took as a specific kind of good sign. She turned and looked at him. Really looked at him for the first time since the OR, without the emergency filtering everything into task and procedure. He looked like someone who had come very close to several different kinds of dying in the past few hours and had not managed any of them. His color was still off, his breathing shallow but regular, his face in sleep less guarded than it would have been awake. He'd asked for her. On a helicopter, in the space between surviving and not, he had signed a document and asked for her by name. She looked away. Harland had Vale's arm and was speaking to him in the quiet, official tone of someone who did not need to raise their voice to convey consequence. 2 Marines flanked them. A third was in the corridor, already on a radio. Dre was looking at Emily. "The intelligence leak," she said. Vale was the contact point. He had the timeline because he had access to Meridian's network even after the dissolution. Someone inside kept the channels open. "We're going to need your full account." "I know. Tonight." "I know, Dre." He was quiet for a moment. "There's something else." Harlan got word from the forensic team that was pulling Vale's office records. A pause. He's been tracking your personnel file for 18 months, flagging your schedule, your assignments. He looked at her steadily. He knew what you were. Not everything, but enough. He kept you in supply specifically, made sure you stayed there. Emily absorbed that. 18 months. Every time Vale had redirected her, every dismissal, every moment of contempt that she'd filed under professional arrogance, it had not been only arrogance. Some of it had been deliberate. Deliberate management of a person he'd been told to keep small and out of the way. She thought about the supply room, the inventory clipboard, the burnt coffee, 3 years of Tuesday mornings. She thought about Gerald in bed 4 and the way he'd looked when someone actually listened to him. Something in her chest that had been tight for a very long time was doing something complicated. "He's in custody?" she said. "As of right now," Dre said. "Then I need to check on my patient." She moved to Vero's bedside. She checked his lines, checked his dressing, read his monitor values in the professional shorthand that bypassed language and went straight to meaning. She adjusted his oxygen flow by half a liter and noted it on the chart that one of Dre's corpsmen had started at the door. Outside in the corridor, she could hear the specific noise of a situation being formally processed. Voices, equipment, the radio cadence of people doing official things. And she was aware, distantly, that what was happening out there was the beginning of something that was going to complicate her life in ways she hadn't fully mapped yet. But right now there was a patient in front of her who was alive because she'd been in the right building on the right afternoon, and that was enough to pay attention to. She was writing in the chart when the monitor alarm sounded, not the steady tones of stable vitals, the sharp, rhythmic spike of something changing fast. She looked at the screen. Vero's heart rate had dropped from 88 to 51 in under 30 seconds. His blood pressure, which had been climbing steadily, was falling, 74/40, and dropping. "Dre," she said, and her voice cut through the corridor noise without being loud. "Get Wen down here. Now!" She was already at the bedside, hands moving, mind running the differential. Vagal response, bleeding, tamponade. The second bleed she'd controlled but warned needed a follow-up look in 6 to 8 hours, and they were barely 3 hours post-op, and the monitor dropped again. 61/38. "He's crashing," Emily said, and reached for the emergency call button, and in the same motion started doing the thing she'd been doing her entire adult life, which was refusing to let someone die when she had hands and a reason to use them. The emergency call button brought people, but people took time, and time was the one thing Varro did not currently have. Emily had the chart in her hand for 2 seconds before she put it down. The chart told her what had already happened, which was less useful than her hands telling her what was happening now. She got the bed rail down, got her stethoscope on his chest, and listened. Left lower lobe, diminished. Significantly diminished. More than 3 hours of post-op recovery explained. His abdomen was slightly more rigid than it had been when she'd checked him 20 minutes ago. Not tamponade, not a primary cardiac event. Bleeding. The second bleed she'd flagged, the one she'd controlled but warned about, it had reopened, and it had done so faster than the 6 to 8 hour window she'd estimated, which meant the stress of whatever had happened in this room with Vale had accelerated something that had been marginal to begin with. She had the IV flow open to wide before Wen came through the door. "Left-sided bleed reopened," she said without looking up. "He needs to go back in." Wen was already at the monitor, reading it with the fast competence that had made her trust him the first time. "Agreed. BP is, I can see the BP." She looked at him directly. "Can you keep him stable long enough to get him to OR?" Wen considered this for exactly as long as it deserved, which was about 3 seconds. "If we move now, then let's move now." Dre had appeared in the doorway. She didn't have to explain. He read the room and immediately had his radio up, clearing the corridor, his voice doing the command thing it did when he stopped asking and started directing. They moved Varro in 90 seconds. Emily stayed at the head of the bed, one hand on his shoulder, not for medical reasons exactly, or not only, and tracked his monitor values as they rolled him down the corridor toward the elevator. His pressure was at 67/32. His rate was down to 44. He was running out of room. "Talk to me, Wen," she said in the elevator. He's maintaining, barely. Wen had a hand on the fluid line, adjusting. He's strong. That's the only reason we're still having this conversation. The elevator doors opened on the surgical floor and the corridor was already prepared. Priya had done that, Emily would realize later, had anticipated the need and staged the OR without being asked, which was the kind of thing that happened when someone had been doing a job long enough to think 2 steps ahead of the crisis. Or 1 was the only suite with the setup already in place from 3 hours ago. They went back in. Torres was there. Patel was there. They'd been called back, she didn't know by whom, and didn't ask. They took their positions without commentary, and the room assembled itself around Varro's failing body with the particular efficiency of people who had already done this once today and knew the terrain. Pressure, Emily said. 61/28, Wen said. He's going to arrest if we don't. I know. She had her hands in position. In size. The second surgery was harder than the first. The first had been a known problem with a prepared plan. Device location confirmed, approach mapped, team briefed. The second was a moving target in a compromised field. The tissue was already traumatized from 3 hours ago, the anatomy less clean, the margins between what was bleeding and what was merely unhappy harder to read. She worked by feel as much as by sight, and the feel of reoperated tissue was something she'd learned in conditions that were considerably worse than this, which was the only thing that made it manageable. The bleed was from the intercostal repair she'd done in the first surgery. The clip had held, but the vessel wall around it had been weakened more than she'd assessed, and the combined stress of the afternoon had finally worked it loose. It was a venous bleed, not arterial, which was why Varro was still alive. Arterial, he'd have been gone before Wen reached the room. She got control of it in 11 minutes. Those 11 minutes were not pleasant. Torres was excellent but exhausted. Patel was steady, but the tray was not set up for a second entry, and they were improvising around gaps in the kit. And twice Wen called pressure in a tone that meant hurry without using the word. She did not hurry. She moved at the pace the work required, which was not the same as slow, but was also not the same as the frantic speed that introduced new errors into an already complicated field. Control. Suture. Check. She stepped back from the table at the 53-minute mark. Pressure, she said. 91/62, Wen said. Rate 76, OSAT 97. Better than he'd started the day. She allowed herself to register that. Good closure, Patel, she said. Torres, you held retraction clean the whole time. Good work. Torres looked like someone had told him he'd passed an exam he hadn't known he was taking. Thank you. She meant it. Neither of them had been prepared for this day, and both of them had risen to it, which was not nothing. Most people, when the situation exceeded their preparation, either froze or overreached. These two had neither frozen nor overreached. They'd worked. She left Or 1 for the second time in one day. Harland was waiting outside the surgical suite. Not Dre this time. Dre was elsewhere, doing the things that needed to be done on his side of what this afternoon had become. Harlan had the look of someone who had spent the last hour making calls that would take days to fully unravel. He's stable, Emily said before Harlan could ask. I know. I've been getting updates. He fell into step beside her. We need to talk about Vale. We do. He's been processed and transferred to federal custody. The syringe. Harlan paused in a way that told her the contents had been confirmed. Potassium chloride. Concentration sufficient to induce cardiac arrest within 4 minutes of administration. Emily said nothing. She'd known what was in the syringe. Knowing what was in a syringe and hearing it confirmed were two different things, and she let the confirmation sit for a moment. He's been talking, Harlan continued, partially, enough to confirm the meridian connection, enough to confirm that he received specific instructions to monitor your activity at this facility and limit your operational exposure. Limit my operational exposure, Emily repeated. That's a precise phrase. It's the phrase he used. She turned to look at Harlan. Who gave him those instructions? That's where it gets complicated. Harlan stopped walking. She stopped too. The corridor was empty in both directions, and his voice, which was already quiet, dropped further. Vale received his meridian contacts through a cleared intermediary inside the hospital administrative structure. Someone with access to staffing decisions, scheduling, personnel flagging. Someone who would have had reason to keep you specifically in a position that limited your visibility. Emily let the sentence complete itself in her head. Above veil, she said. Above veil. She thought about the last 3 years. The supply work. The trajectory of her assignments. How they'd started with some variety, some rotation through different departments, and had gradually, over the first 8 months, narrowed to a specific and limited scope. She'd attributed it to her injury assessment, to the hiring physician's notes, to the general indifference of an institution toward a new employee who didn't push back. She'd been managed, precisely and deliberately managed. Who? She said. Harlan's expression told her the answer was coming, but was going to require a specific kind of preparation for. Silver Valley's Chief of Operations, Lawrence Greer. He's been with this hospital for 11 years. His financial records, which a federal judge authorized this afternoon based on our preliminary evidence, show payments from a Meridian-affiliated shell account dating back to 2021. Lawrence Greer. She pulled his face from memory. She'd interacted with him exactly 4 times in 3 years, brief corridor exchanges, the kind of administrative-level acknowledgement that meant nothing. A tall, measured man with gray at his temples and the slightly disconnected manner of someone who processed people as variables. He's in the building, she said. He was in the building, Harlan said. We moved to take him into custody 20 minutes ago. His office was empty. His car is still in the lot. The words arranged themselves into a shape she didn't like. He knows the building, she said. Yes. He knows the layout, the exits, the service corridors. She was already thinking through it. 11 years in this building meant Greer knew every space she knew and several she didn't. Does he know Vale's been taken? Possibly. He has access to hospital communications. Then he knows we're closing in and he's looking for a way out. She looked at Harlan. Or he's not looking for a way out. He's looking for a way to finish what Vale didn't. The silence that followed was very brief. Vero, Harlan said. Vero is the target. He was always the target. Vale's job was the immediate action. Remove the threat before Vero could debrief anyone. Greer is the backup. She was moving again. Where are your Marines? Dre has 2 on the post-op unit, 2 at the building entrances, 2. Get someone to Vero right now, not in 2 minutes. Right now. Harlan had his phone to his ear before she finished the sentence. She moved toward post-op through the service corridor rather than the main hallway, not because it was faster. It wasn't. The service corridor had a jog in it that added 30 seconds, but because Greer would use the main corridors if he was moving fast, and she wanted a different angle of approach. She'd learned that particular habit somewhere in her operational past, and had never found a reason to discard it. The service corridor had a supply staging area halfway along it, a wide alcove with shelving units and a hand truck chained to a pipe. She came around the corner of the alcove and stopped. Greer was there. He wasn't moving toward post-op. He was standing at the shelving unit with his back to her, and he was on a phone, and his voice was the low, controlled voice of someone who had spent years being the administrative calm in every storm and was now trying to apply that same cadence to something that was not a budget meeting. The extraction window is closing. You need to pull the team out of position. Vale is... He stopped. Something on the other end. I understand that. I'm telling you the situation has changed. Carter is... He heard her. He turned. Whatever he'd expected to see when he turned, it wasn't Emily standing 12 feet away in bloody surgical scrubs with an expression that was not angry. Anger would have been easier to navigate, but something much quieter and much more resolved. He moved his hand toward his jacket. Don't, Emily said. His hand stopped. She looked at him the way she looked at situations she was assessing, fully, without the social signals that normally occupied the space between 2 people who knew each other professionally. She looked at what his hand was doing and what his eyes were doing and what his weight distribution said about whether he was about to run or stand, and she arrived at her conclusion before he'd finished deciding. There are 2 Marines 40 feet from here, she said, and the man you're talking to on that phone is operating inside a network that has been under federal surveillance for the last 6 hours. She kept her voice even. Whoever that is, they already know. Whatever they're telling you to do, they're telling you because it doesn't cost them anything if you get caught doing it. Greer's face did something complicated. He was not, she registered, a stupid man. He had the particular intelligence of someone who had spent a decade managing information and had gotten very good at reading the room. He was reading it now, and what he was reading was not in his favor. "You don't know what this is," he said. "I know you've spent 18 months making sure I stayed in a supply room," she said. "I know you routed information to a Meridian contact through Vale, and I know that whatever you were told about me, whatever made you think I was a problem worth managing, you underestimated significantly." His jaw tightened. The hand near his jacket hadn't moved, hadn't retreated either. "There are things involved in this that are beyond what you've been briefed on," he said, and his voice was trying to find the register of someone offering information rather than defending himself, which told her he'd decided the best remaining option was to make himself seem useful. The Vero operation, what he was carrying out of that training location, it wasn't just a joint exercise. There's a reason Meridian needed him removed. There are people involved in this that Harlan's board doesn't have clearance to. Greer. She let the word sit for a second. "Stop talking like you're negotiating. You're not negotiating. You're stalling while you decide whether to run. And I'm telling you, running doesn't work because there are people at every exit who know your face." She took one step forward. "Put the phone down and put your hands where I can see them." His face went through something she'd seen before, the specific collapse of a person who has run their options and found all of them closed. It didn't look like defeat exactly. It looked like exhaustion, like someone who had been managing a very heavy thing for a very long time and had just been told they had to keep holding it and had found they simply didn't have the strength. He lowered the phone. He put his hands at his sides. "There's a recording," he said, and his voice had changed, flatter now, stripped of the management cadence. "In my office, second drawer, under the budget binders. A drive. Everything I know about the network, the full contact chain, the shell accounts, the directive that came down on Carter specifically." He looked at her. "I kept it because I wasn't sure I was going to be on the right side of this when it ended, and I wanted something to trade." Emily looked at him for a long moment. "That drive better be exactly where you say it is." "It is." "Then I suggest you stay very still and wait for the people who are going to come around that corner in about 30 seconds. He stayed still. Dre came around the corner in 28 seconds, 2 Marines behind him, and took in the scene without visible surprise, which was, she'd decided, simply how Dre moved through the world. "Greer," Dre said, with the flat recognition of someone confirming an identification. "He has a weapon in his jacket," Emily said. "He also has a drive in his office, second drawer, that he says contains full documentation of the network. I'd retrieve it before anyone else has access to that office." Dre nodded once. The Marines moved to Greer, and Greer did not resist, just stood with the settled stillness of someone who had made a decision and arrived, however badly, on the other side of it. Emily turned and walked back toward post-op. Varro was where she'd left him. Bed 4, monitor steady, the particular stillness of genuine recovery rather than the tense stillness of someone holding themselves together. His pressure was reading 94/66. His rate was strong at 72. The second surgery had bought him what the first had been trying to buy him, time for his body to decide to stay. She sat in the chair next to his bed. Just sat. She couldn't remember the last time she'd sat down. Her knee was a specific and detailed kind of bad. Her left shoulder ached from the angle she'd held in the second surgery. She was aware of being hungry in the distant, theoretical way that she got when her body had deprioritized hunger in favor of more pressing things and was now cautiously reminding her it still existed. She sat with all of it and looked at Varro's face and thought about 18 months. Not with bitterness, exactly. Bitterness required a kind of energy she didn't have left, and also she'd never found it particularly useful. But she let herself look at it plainly. The supply room, the clipboards, Vale's particular brand of contempt, Greer's careful administrative shaping of her role, and acknowledged that it had happened and that it had cost her something she didn't fully have a name for. Not just time. Something harder to quantify. The slow erosion that happened when you were placed in a container that was the wrong shape and left there long enough to start doubting your own dimensions. She'd stopped doubting them today, somewhere in the middle of a 22-minute surgery with a live explosive 2 centimeters from a major artery. The timing was not lost on her. She heard footsteps in the doorway and looked up. Torres. He'd changed out of his surgical scrubs and his hair was doing something unfortunate, and he looked like someone who had been through something significant and was still in the process of integrating it. "He's going to be okay?" Torres asked, nodding toward Varro. "His numbers say yes." Torres looked at the monitors, then at her. He was putting something together. She could see it in the way he was deciding whether to say it. "I looked you up," he said carefully. I tried to look you up. Your record, in the hospital system. And? It says supply nursing, logistics certification, 3 years of service." He paused. "And then there's a flagged field that says clinical records restricted, federal hold. I've never seen that on a staff file before." Emily said nothing. "You were going to let them keep you in the supply room," Torres said. "You could have, at any point you could have pushed back. Why didn't you?" She thought about how to answer that because it deserved an answer that was actually true rather than one that was easy. "Because I didn't come here to prove anything," she said. "I came here because I needed somewhere quiet." "But you weren't just doing inventory." "No," she said. "I was watching, listening, learning the building, learning the patients." She looked at him steadily. "Nowhere you go is wasted time if you pay attention." Torres absorbed this with the expression of someone who had received information they were going to be thinking about for a while. "For what it's worth," he said, "you're the best surgeon I've ever assisted, and I've assisted Vale." A pause. "That's saying something." She almost smiled. "Get some sleep, Torres." He left. She turned back to Varro. On the monitor, his heart rate showed a single irregular beat, a PVC, a premature ventricular contraction, and then returned to its steady rhythm. Her eyes went to the screen. Normal, post-operative, common. She tracked the next 6 beats to confirm the pattern was stable, and it was. She sat back. Harland appeared in the doorway at 9:47 that evening with 2 cups of vending machine coffee and the expression of someone who had spent several hours on the phone and had emerged from those calls with both good news and a new category of problem. She took the coffee without being asked. It was terrible. She didn't care. "The drive was where Greer said it was," Harland said. "Our forensic team is processing it now. Preliminary assessment is that it contains documentation on 11 Meridian-affiliated contacts, 3 of whom are currently embedded in facilities with federal contracts." He sat down in the second chair, which nobody had invited him to do, but she didn't object. "Vale's syringe has been formally logged as evidence of attempted murder. He's looking at federal charges that will take approximately the rest of his natural life to resolve." "And Greer?" "Cooperation agreement is being drafted. He'll testify against the broader network in exchange for reduced, not eliminated, reduced exposure. The information on that drive is significant enough that the prosecutor's office is very interested in what he knows." Harlan paused. "He asked about you." Emily looked up. "He said..." Harlan checked something on his phone. "He said to tell you he knew from the first week you were here that they'd made a mistake, that you were the wrong person to try to keep quiet." He put the phone away. "I don't know if that's supposed to be an apology or a compliment." "It's neither," Emily said. "It's just a man explaining himself because that's what people do when they're out of options." Harlan nodded slowly. "The hospital board has been notified of today's events. All of them. The CEO was on a call with federal representatives for 2 hours this afternoon." He looked at her sideways. "There is going to be a very significant HR conversation in the near future regarding your employment status." "I know." "And your credentials, your actual credentials." "I know that too." "Carter," he leaned forward slightly, "I'm not just talking about clearing your name. The board is going to want to discuss what your role at this facility should actually look like, given today." Emily drank the terrible coffee and looked at Varro's monitors and said nothing for long enough that Harlan shifted in his chair. "I don't know what I want yet," she said finally. "I just got done surviving the day. Give me until tomorrow." Harlan nodded. "Fair enough." He stood to leave, then stopped. "One more thing," he said, and his voice had changed in a way that made her set down the coffee cup. The documentation on Greer's drive, the contact chain he mentioned, the directive on you specifically. He paused. It goes higher than Meridian. The entity that flagged you, that issued the original containment directive. It's not a private contracting group. She looked at him. It's a government designation, Harlan said. A program that was officially shut down in 2020 and officially no longer exists. He held her gaze. Except it appears to still be operational, and it appears to have been tracking you specifically since your medical discharge. And the reason it's been tracking you, he stopped. The reason is in a file that was sealed under a classification level that requires approvals I don't currently have. The room was very quiet. Someone higher up knew about me, Emily said. Someone higher up has been very interested in you, Harlan said. For a long time. The question is whether that interest was the same kind of interest as Meridian's, or something else entirely. He left. Emily sat in the chair next to Vero's bed, in the quiet of the post-op unit, with the monitors beeping their steady rhythm around her, and she turned Harlan's last words over in the way she turned problems over, not anxiously, but thoroughly, looking at each face of the thing. A program that officially no longer existed, a sealed file, someone who had been watching her for years, not to manage her out of the way, but for a reason Harlan couldn't access. She looked at Vero's face. He'd signed a document on a helicopter and asked for her by name. She'd assumed that was about the surgery, about her skills, about the specific intersection of what she could do and what he needed. But Vero had been conscious long enough to sign a document, long enough to make a specific request. And Vero, as a colonel in a classified joint operation, would have known things about the programs that Harlan was now discovering the edges of. She reached into her scrub pocket and pulled out the folded document Harlan had given her in the lobby. The one Vero had signed in the helicopter, the one she'd read twice and folded again and carried all afternoon without fully examining what it meant. She unfolded it now. She read it again, slowly this time, without the adrenaline of the moment translating the words into their most immediate meaning. The third paragraph, which she'd read as an authorization for her medical intervention, contained a sentence she'd processed quickly and moved past. She read it again. The above-named individual is hereby recognized as a classified asset under Program Lightwell, active status, and is to be afforded full federal protection and operational disclosure as determined by the reviewing authority. She read it a third time. Program Lightwell. She'd never heard that name. In 12 years of operational service, she had never once encountered that designation, which meant it hadn't existed when she was active, which meant it had been created after her discharge, which meant someone had built a program around her after she left, or around what she represented, or around what she knew, or around something she had done that she did not yet fully understand the significance of. Vero's monitors beeped steadily in the quiet room. His eyes opened. His eyes opened slowly, the way eyes opened when the body was still negotiating with consciousness. Not the sharp alert of someone waking from normal sleep, but the gradual, effortful surfacing of someone who had been somewhere very far down and was working their way back up through layers. Emily folded the document and put it in her pocket. She set down the coffee cup. She moved her chair slightly closer to the bed and waited, giving him the seconds he needed to locate himself in the room. Vero's gaze found the ceiling first, then the monitors, then her. He looked at her for a long moment without speaking. His eyes were clearer than she'd expected, alert in the specific way of someone who was in significant pain and was managing it through the same mechanism he managed everything, which appeared to be a high baseline of controlled endurance. "You're alive," she said. Not a question. Apparently. His voice was rough, wrecked by the intubation tube, and he cleared his throat carefully in a way that suggested his chest was reminding him of the last several hours. How bad? 2 surgeries, the first for the device extraction, the second for a rebleed that opened up 3 hours post-op. She watched his face absorb this. You're going to feel like you lost a fight with a truck for about 6 weeks. After that, with proper rehabilitation, you should recover close to full function. Close to. The left side took significant trauma. I'm not going to promise you something I can't guarantee. He almost smiled at that. A small, painful thing that didn't make it all the way across his face but was visible in the corners. Most people would promise it. I know, Emily said. He was quiet for a moment. His eyes had dropped to her scrubs, the blood on them, dried now, the marks of a very long day. You did both surgeries? Yes. Alone? With a team, I directed. He looked at her with an expression she couldn't fully read, something between assessment and something more personal, the look of someone who had known her reputation before they knew her face and was now doing the work of reconciling the two. I heard what happened, with Vale, with Greer. His voice was careful. Dre briefed me, 6 minutes ago, before you realized I was awake. He's very efficient. He is. Vale tried to... He stopped, recalibrated, while I was in post-op. Yes. And you stopped him? Yes. Vero closed his eyes for a moment. When he opened them, something had shifted in his expression. Not softer exactly, but more deliberate, the way a person looked when they were deciding to say the true version of something rather than the useful version. I've known about you for 4 years, he said. Not personally. Your file. What you did before the discharge. The operation in Coast Province. The one where you held a surgical field for 6 hours under active fire and brought 4 men back who had no business being alive. Your commanding officer submitted your name for a commendation that was reclassified before it was processed. He held her gaze. I always thought that was wrong. Emily said nothing. She knew the operation he was talking about. She tried not to know it most of the time. It lived in the part of her that she'd filed carefully away, not because she was ashamed of it, but because looking at it directly cost something she couldn't always afford. I requested you specifically, Vero said. When we knew we needed to divert, I told Dre, if there's anyone in that city, any city, who can manage a simultaneous trauma extraction and EOD operation, it's Carter. Find Carter. He paused. I didn't know you were here. That was... He seemed to search for the word. That was luck. Or whatever the secular version of that is. Coincidence, Emily said. Terrible coincidence from where I was standing. From where I was standing, it was the difference between dead and not dead. She looked at the document in her pocket. She could feel it there, the folded edge against her hip, and decided to say the thing directly because she'd never found another way to do it. Varro. Lightwell. His expression didn't change. Not a flicker, not a shift, which was itself an answer. Harlan found it, she said, in Greer's documentation. I know. He was quiet for 3 full seconds. How much do you know? Name only. No context, no origin. She watched him. But I know it was built after my discharge, and I know my name is attached to it. Vero looked at the ceiling for a moment in the way of someone who was having an internal conversation about how much to say and had reached a conclusion. Lightwell is a medical contingency program, he said. It identifies and tracks individuals with specific combined skill sets, advanced trauma surgery, tactical field experience, EOD familiarity, that don't exist in sufficient numbers inside active military medical units. A reserve of people who are not on active duty but who can be located and activated for situations that standard channels can't address. He paused. There are 7 names on the Lightwell registry. You're one of them. Emily absorbed this. I've been on a list, she said, a classified list, that has never been used until today. And the containment directive, the reason Meridian flagged me. Because someone inside Meridian had access to the Lightwell registry and understood what it meant. And because Vero... He stopped, recalibrated with something that might have been self-awareness. Because I was the one who pushed for the program's creation, and someone inside Meridian knew that neutralizing me required first ensuring that the people who could address a crisis of this kind were managed, kept small, out of position. Emily sat with this for a moment. The supply room. The inventory. 18 months of deliberate diminishment, rooted not in Vale's arrogance, which was real and entirely his own, but in a calculated operation designed to ensure that when something like today happened, she wouldn't be ready. They'd underestimated what ready looked like on someone who had spent 3 years paying attention to a building and its people. I need to know, she said, whether being on that list means I have a choice about what happens next. Vero looked at her. Yes, he said, it always means a choice. That was a condition I put into the program's design. He held her gaze. You've earned the right to walk away from all of it. From Lightwell, from this hospital, from everything that happened today. Nobody will compel you. And if I don't walk away? Then we have a conversation when I'm not lying in a hospital bed held together by your sutures about what a role in this program actually looks like. What you'd be doing, what you'd have access to, what you'd be allowed to be, officially, in ways you haven't been allowed to be for 3 years. Emily nodded slowly. When you're not in a hospital bed, give me a week, he said, and the dry edge in his voice was the voice of someone returning to themselves from a very long way away. Rest, she said, and stood. I'll check on you in the morning. She was at the door when he said her name. Not her call sign. Her name. Carter. She looked back. Thank you, he said. And unlike almost every other thank you she'd received in this building over 3 years, it had no agenda attached to it. It was just a man saying a true thing. Get some sleep, she said. The morning came in the way mornings came after days like that one. Not gently, not with any particular ceremony, just the light changing outside the window of the small office Dre had arranged for her to use overnight. Gray going to pale gold, going to the specific flat brightness of a Midwestern November morning. She'd slept 3 hours in the chair. She'd slept in worse places. She got up, checked on Varro, stable, pressure holding at 102/68, rate steady at 70. Wen had left a note on the chart that said, good progress, pain management adjusted. Anticipate extubation of remaining drain by Thursday in handwriting that was remarkably legible for a physician. And then she went downstairs because there were things happening downstairs that she'd known since last night would need to be faced. The hospital lobby at 8:15 in the morning looked like a location that had recently hosted a significant event and was still sorting out how to present itself. 2 federal vehicles were parked outside, visible through the glass. A cluster of staff near the main desk were in conversation with a woman in a dark blazer who had the manner of a federal liaison and was taking notes on a tablet. The Marines were gone. They'd transported Varro's care team out the previous evening, leaving 2 personnel for overnight continuity. But their absence had not restored the building to normalcy. Normalcy, Emily suspected, was going to take a while. She was heading toward the nursing station when she heard Vale's name. She stopped. 2 residents, she didn't know them well, had cataloged their faces and roughly their competence levels, which was the kind of inventory she made without deciding to, were standing near the elevator, voices low, but not low enough. They're saying federal charges, like actual federal charges, not just licensing board. Attempted murder is federal, yeah. And Greer, I still can't. A pause. Greer's been here since before I was in med school. I know. And Carter, the voice dropped further. She caught the edge of it, but not the full sentence. She moved on. At the nursing station, Priya was behind the desk with the look of someone who had been there since 6 and was going to be there until the situation resolved enough to stop requiring her specific brand of competent management. She looked up when Emily approached and said, without preamble, "There's a board meeting at 10. They asked for you to be present." "I know. And HR sent a request. I know about that too." Priya looked at her for a moment with the expression she'd been wearing more and more since yesterday afternoon, like she was recalibrating something she'd thought she understood. "Emily." "Yeah." "I owe you an apology." Emily shook her head. "You treated me the way the institution told you to treat me. That's not on you." "I could have pushed back. I saw Vale dismiss you at least 30 times. I thought—" Priya stopped. "I thought you just didn't have the capacity for the trauma work, because of your leg, because of the way he talked about you." Her jaw tightened. "I should have questioned it." "We all work inside the story we're handed about someone," Emily said, "until we don't." She meant it without bitterness. It was just true. You prepped her one without being asked when Varro crashed. That mattered. Priya's eyes went somewhere difficult for a second. Then she nodded. "The board meeting is in conference room A, 2nd floor." "I know where it is." She went upstairs. The board meeting was not what she'd expected, which was itself information about how significantly the events of the previous day had rearranged the furniture of Silver Valley Medical Center's institutional reality. There were 7 board members present, plus the hospital's CEO, a woman named Dr. Sandra Osai, who had the focused intelligence and slightly exhausted quality of someone who had spent the night on phone calls that required both legal knowledge and damage control, plus Harland, who was there in an official capacity that he'd explained to the board the previous evening and that they'd apparently accepted without significant resistance because federal liaisons tended to clarify the hierarchy of a situation very efficiently. They'd also asked Torres to attend, and Patel and Dr. Wen, which told Emily that the meeting was not going to be purely administrative. She sat at the table and did not speak for the first several minutes, while Osei laid out the situation in the measured, factual language of someone who had decided that complete transparency was the only viable response to a complete institutional failure. She did not minimize Vale's conduct. She did not soften Greer's role. She presented the timeline, the evidence, the federal involvement, and the consequences in language that was both precise and, Emily recognized, genuinely uncomfortable for her to deliver. Good. It should be uncomfortable. Miss Carter, Osei said when she'd finished the overview. First, on behalf of this board, I want to formally acknowledge what you experienced at this facility over the past 3 years. The barriers placed on your professional function, the deliberate limitation of your role, the failure of this institution to recognize your qualifications and conduct, that was a serious failure. Some of it was engineered from outside, but some of it was accepted without question by people at this table. And that is something we're going to be accounting for. Emily looked at her. Acknowledged. Second, Osei folded her hands on the table. The question of your professional status at this facility needs to be addressed immediately. Your nursing license is active. Your additional qualifications? She glanced at Harland. The ones that have been operating under federal hold will be formally disclosed and recognized. We'd like to discuss what an appropriate role looks like, given those qualifications. I appreciate that, Emily said. I'd like to table that conversation for a few days. A slight pause around the table. Of course, Osei said. What I won't table, Emily continued, is the structural conversation about how this happened. Not the Meridian piece. That's federal, and Harlan's people will handle it. I mean the institutional piece. The way a senior physician was able to consistently limit a staff member's function for 3 years without anyone formally reviewing it. The way a chief of operations could flag personnel files and shape assignment decisions without triggering any audit mechanism. She looked around the table. That's not a Meridian problem. That's a Silver Valley problem. And if it happened to me, it happened to other people here who didn't have what I had. A reason to wait it out, a reason to stay quiet, something to go back to eventually. She paused. The people who didn't have that, who got pushed out entirely, who got managed into quitting. I'd like someone at this table to be responsible for finding out who they are. The room was quiet. Osei held her gaze. That's a reasonable request. It's not a request, Emily said evenly. It's a condition. Another pause. Harlan, to her left, was looking at the table with the expression of someone who was not going to say anything but was registering everything. Understood, Osei said. The meeting continued for another 40 minutes. The specifics were worked out in the measured language of institutions trying to correct themselves. Internal review processes, external audit, HR restructuring, a formal review board for credentialing decisions that would include clinical staff representation. None of it was fast. None of it was going to fix anything immediately. But the bones of it were real, and real bones were more than she'd walked in expecting. When it ended, she was the last to leave the room. Harland held the door. That was not what most people do in that situation, he said. What do most people do? Accept the apology, take the job offer, move on. Most people weren't thinking about the ones who didn't make it to the meeting, Emily said. He nodded slowly. The Lightwell conversation. Vero wants to have it when he's transferred to the military medical facility next week. He said to tell you. He checked his phone. He said to tell you there's no deadline and no pressure, and he means that. And also that he owes you dinner in a city of your choosing, which I'm passing along as instructed, even though I'm not entirely sure it's within my remit. Emily almost laughed. Almost. Tell him I'll think about it. She went back to the supply room on the 3rd floor because she had things there. Not many. She'd never been someone who accumulated things in a workspace, another habit from a life that had required moving quickly. But a jacket, a thermos, a battered paperback she'd been reading in 15-minute increments for 2 months. She packed them into a canvas bag and stood in the middle of the room for a moment. The shelves were orderly. The inventory was accurate. The IV bags were stacked correctly, and the count would be right because she'd made it right, over and over, across 1,000 quiet mornings. She'd done good work here. She needed to allow herself that. Not the dramatic work of yesterday, not the surgeries or the EODD operation or the confrontation in the service corridor, but the other work, the quiet kind, the work that nobody wrote citations for. Gerald in bed 4, frightened and dismissed, who'd had someone actually listen to him. The supply discrepancies she'd caught that had prevented medication errors. The inventory accuracy that kept the ER from running short on a bad Tuesday morning. None of that had been wasted. She'd told Torres that, and she'd meant it, and she needed to mean it for herself, too. She picked up her bag and turned off the light and closed the door. Watson. In the parking lot, the November air was cold enough to be clarifying. The helicopters were long gone, had left around midnight, once Vero's status was confirmed stable enough for the transport timeline to hold. The parking lot looked like a parking lot again, which felt faintly surreal. She put her bag in her car and stood for a moment with her hand on the door. Her knee ached. It would ache tomorrow and the day after. The left shoulder where she'd held the retraction angle too long was going to be sore for a week. Her body was a running tally of decisions made and prices paid, and she'd been carrying that tally for long enough that she mostly didn't notice it anymore, except on mornings like this one, when everything had been used and the accounting was hard to ignore. She noticed it now. She let herself notice it. Footsteps behind her. She turned. Danny Reyes, the ER nurse who'd been eating a granola bar at the adjacent workstation approximately 1,000 years ago, which had actually been yesterday morning. He was in street clothes, end of a shift, and he had the specific combination of tired and wired that came from working through a major incident. He stopped a few feet away. He looked at her like he was trying to decide whether to say the thing. "Say it," she said. "I always knew you were more than supply," he said. I didn't push on it. I figured it was your business." He paused. "I should have pushed. I should have said something to Vale. I heard him talk to you the way he talked to you more than once, and I kept thinking it wasn't my place." Emily looked at him. "It was your place," she said. Not harshly, just true. He absorbed that. "Yeah." He nodded slowly. "Yeah, I know." He didn't make excuses for it, which she respected. "You gonna come back?" "I don't know yet," she said. "For what it's worth, and I know it's maybe not worth a lot right now, the floor is different without you. Has been, since early this morning when everyone figured out what happened." He paused. "People are saying things about you, good things, the kind of things they should have been saying a long time ago." "People say things when the story changes," Emily said. "That's not the same as them seeing someone clearly." "No," he agreed. "It's not." He held out his hand. "Take care of yourself, Carter." She shook it. "You too, Danny." She got in her car. She drove for a while without a destination. Not aimlessly, she was never truly aimless, but she needed motion before she needed arrival. The city moved past the windows in the particular way of a mid-morning weekday, unhurried, people going about the ordinary business of lives that hadn't been detonated and rebuilt in the last 24 hours. She thought about what Vero had said. A conversation, when he was better, about what she'd be allowed to be officially. The word allowed snagged in her thinking. She'd spent a long time operating inside what she was allowed to be, and before that she'd spent a long time operating so far outside conventional allowances that the concept had barely applied. Somewhere between those two periods, she'd lost the thread of what she actually wanted, as opposed to what she was willing to accept. She pulled into a parking lot. A park, actually, a city park she'd passed on her commute every day for 3 years and had never entered, and got out of the car. The park was nearly empty. A woman walking a dog. 2 kids on a bench doing something with their phones. She walked the main path slowly, her knee accepting the flat surface with something like gratitude. The cold air doing what cold air did, which was make everything feel slightly more actual. She thought about what she'd said in the board meeting, the condition she'd placed, The people who'd been managed out, pushed out, worn down without the specific circumstances that had kept her in place long enough to be found. She'd said it because it was right, and because someone needed to say it, and because she'd meant every word. But she was also aware that saying it had committed her to something, to caring about what happened next, to not simply walking away clean. You didn't ask for accountability and then leave before you could see whether it held. That was the thing nobody told you about the kind of strength she'd been carrying. It wasn't about any single moment, the surgery, the confrontation, the device in the containment unit. Those were just the visible things, the things that translated into a story someone could tell. The actual strength was quieter and less dramatic and much harder to sustain. The willingness to stay present in a situation past the point where staying was comfortable, because something there still needed you. She'd been doing that for 3 years without knowing she was doing it. She was going to do it differently going forward, more consciously, on her own terms. Her phone buzzed, a text from a number she didn't recognize, then, below the number, an identifier that Harlan's team must have added to her contact list at some point overnight. Varo J. Colon, the text said, "Wen tells me you adjusted my O2 flow in the post-op unit. He says it was the right call. I told him I wasn't surprised." Vichy stood in the cold park and read it twice, and then put her phone away. She would call back. Not today. Today had already asked enough of her, but soon. She would have the conversation about Lightwell, and what it meant, and what she wanted from it, and she would make that decision from a place that was not fear and not exhaustion and not the ground-down diminishment of someone who had spent 3 years being told, in 100 quiet ways, that she was less than she was. She knew what she was now. She'd always known. But knowing it alone and having it confirmed in a room full of people who'd spent years not seeing it, those were different experiences, and she was still integrating the difference. The woman with the dog passed her on the path and nodded. Emily nodded back. She stood in the thin November light and let herself feel what the day had left her with. Not triumph, not exactly, because triumph implied something had been won in a clean and satisfying way, and nothing about the last 24 hours had been clean or satisfying. It had been hard and painful and costly, and it had also, in some fundamental way, put her back in alignment with herself. The version of herself she'd been before the supply room, before the careful management, before 3 years of being told to take up less space, but also not entirely that version, because that version hadn't known yet what it cost to hold a surgical field for 22 minutes with a live device in the room, or to stop a man with a syringe using nothing but positioning and a tone of voice, or to sit next to a patient all night and simply refuse to let go. She was both of those people. She'd earned both of those people. She walked back to her car. She started the engine. She sat for a moment with her hands on the wheel. There was a lot ahead of her. The conversations, the decisions, the reconstruction of something that looked like a life with a shape she'd chosen rather than a shape she'd been assigned. That work would be slow and imperfect, and on some days probably bleak, because most real work was some combination of those things. But she'd done harder work in worse conditions with less to go back to. She put the car in gear. The thing about being the person everyone underestimates is that you spend a long time carrying the weight of their wrong idea about you, and it bends you, and some days you start to believe the bend is permanent. You stop pushing against it. You learn to move around it. You get so good at operating inside the limitation that you forget it was imposed from outside rather than grown from within. And then one day, something happens. A radio call sign through a wall, a helicopter in a parking lot, a dying man who remembered your name, and the limitation reveals itself for what it always was. Someone else's story about you, told for someone else's reasons, that you were never obligated to live inside. Emily Carter pulled out of the parking lot and drove toward whatever came next. She did not look back.